I saw someone post a question in a forum for people with mild cognitive impairment asking, after you were diagnosed, who did the neuropsychiatrist suggest you work with? A neurologist? A general practitioner? I hate to say it, but the replies were pretty sad and pretty telling. One woman said they didn't have any suggestions, just a diagnosis and have a good day. Nobody, another said, just diagnosed and left to get on with it. Welcome to the world of MCI, where you get a diagnosis for this frightening, baffling medical condition that you've never heard of, and then they just send you home and wish you luck. That's not me saying that. That is the assessment of Dr. Oscar Lopez, one of the leading authorities on mild cognitive impairment. I was talking with him about this the other day, and he told me the thing now is you go to see your doctor, and your doctor tells you that you have MCI and says, good luck. There is nothing I can do for you. Come and see me again next year. Well, don't believe that. There is a lot they can do for you. So today, I want to offer you a basic understanding of the treatments for mild cognitive impairment so that you can know about all the latest and best care, and so you can make sure you're getting it. Hi, I'm Tony Deering of GoCogno.com, the website for people with mild cognitive impairment. So today, let's demystify the treatment of MCI, and let's start by blowing up this myth that there's nothing they can do for you. What you're looking at here are the new MCI treatment guidelines that were just issued by the American Academy of Neurology. This is the first time these guidelines have been updated since 2001, so it's a big deal. And I count almost 20 treatments here. Does this look like nothing to you? No, these guidelines are extensive, covering how MCI is properly diagnosed, identifying possible causes, talking about biomarkers, clinical trials, treating apathy, anxiety, and depression, and addressing a variety of approaches to potentially slowing cognitive decline and reducing your risk of dementia. Now, I would love to walk you through all these treatments, and I actually tried to do that. I shot a version of this video where I talked about all the treatments, but when I was done, it was like 40 minutes long. And I looked at it and I said, nobody's going to watch this. I wouldn't watch this. So instead, I created this MCI treatment checklist. It explains the treatments in plain language, so it's easy to understand and it's simple to use. The checklist is free and it's something I'm glad to send to you. At the end of the video, I'll show you how you can get it. But for now, let me touch on a few key things. And the first of them is exercise. For the first time, the treatment guidelines urge your doctor to recommend that you exercise at least twice a week. It's one of the first and best defenses against cognitive decline. As Dr. Anders Hansen recently told me, it is not controversial to say the single most important thing a patient with MCI can do to slow the disease is physical activity, preferably a walk. Second, off-label drugs. According to the guidelines, there's no medication approved to treat mild cognitive impairment, and your doctor has probably explained that to you. However, doctors do have the discretion to provide Alzheimer's drugs off-label to people with MCI. Dr. Lopez, who helped write the new guidelines, told me the studies looking at whether these drugs can help have been inconclusive. Some suggest they might, some say they won't. He told me, if you're a patient with MCI and go to see a doctor, you know MCI is a risk factor for Alzheimer's. The doctor should tell the patient, I will help you with your decision. It's sort of a gray area, and the more information the doctor provides you, the better. It's very important that the decision be that of the patient, and the patient may say, look, I want to try one of these medications and see what happens. The last thing I want to talk about is monitoring how you're doing. The treatment guidelines say that your doctor should continue to assess you over time for any changes in your cognitive status. That's pretty vague. So I asked Dr. Lopez, how often is often enough? And he told me that once a year is about right. It tends to progress very slowly, he told me. Doing an evaluation every 6 months, you may not detect change. Doing an evaluation every year, it's easier to compare the 2 points. However, he also told me that if at any point you notice a sudden, dramatic change in your cognition and your next appointment is still months away, don't wait. Let your doctor know that immediately. If things are not working well, you need an in-depth evaluation of things that are happening in the body that would affect the brain, Dr. Lopez told me. Sudden changes could be related to your kidneys not working well or could be related to the lungs. Now, this is a sampling of the new guidelines, but I really want you to understand all of the treatments that are available to you. That's why I put together this 2-page MCI treatment checklist. It's yours when you sign up for my weekly brain health email, and both are absolutely free. I'll send you the list, and then you can just go down and check each item off. If you can check yes to everything on the list, then you can have confidence that you're getting all the right care that's available to you. Now, if you'd like this checklist, there's a link showing how you can get it below the video, and I'm also including a link to a very detailed description of all the guidelines if you want to know more about that. I hope that this has been helpful to you, and I hope to see you again next week. Until then, as always, be kind to your mind.